Hello, my name is Megan and I will be presenting a patient to you. The patient is a 61-year-old black female from Ann Arbor. She is not married. Her normal occupation is a security guard for a library and a church. Patient has Medicaid health care. She has a pulse of 82 beats per minute, normal respirations, blood pressure of 165/89. She weighs 265 pounds and she has been slowly losing weight over the past 3 months. The patient's chief complaint is abdominal pain due to a small bowel obstruction. After feeling abdominal pain for a few months, she went into her doctor and was told that she had a small bowel obstruction and would need surgery. She was admitted to the University of Michigan Healthcare Acute Center for Surgery on January 29, 2014, due to recurrent small bowel obstruction. She was moved to Heartland Healthcare Center after her surgery on February 3, 2014, for rehab for her chronic pain associated with debilitation. The patient also has type 2 diabetes, asthma, gastroesophageal reflux, hypertension, obesity, chronic joint pain, hyperlipidemia, diabetic neuropathy, and iron deficiency anemia. Her psychological issues include adjustment disorder, anxiety, a depressed mood, and post-traumatic stress disorder. The patient's immunizations are up to date, including flu and pneumonia vaccinations. As a child, she had measles and chickenpox. She has had drug reactions in the past to aspirin, morphine, and non-steroidal anti-inflammatory agents. The patient does not use drugs, alcohol, or tobacco, and she does not exercise regularly because she is chair or bed bound all of the time. Her sleep patterns are normal, she has normal nutrients, and she usually eats everything that is given to her on her tray. She usually uses a seatbelt when riding in a car. The first system that I assessed on the patient was peripheral vascular. I chose this assessment because the patient is not very mobile at this time, she's obese, and she has hypertension. She has many of the risk factors for venous insufficiency, like prolonged bed rest, obesity, and immobility. During the review of systems, she reported some pain in her lower legs and swelling at the ankles. Her temperature felt normal. She does not smoke. She is unable to exercise in her current state. She has family history of obesity, diabetes, and hypertension. Next, I examined the patient. Her temporal, carotid, brachial, and radial pulses were all strong, normal, and easy to find, so I rated them 2s. However, it was hard to find her popliteal, tibial, and dorsalis pedis pulses. They were all weak, so I rated them 1s. When feeling her legs, I noted that they were tender, there was some edema, and there were some swelling around her feet and ankles. She had no hair on her legs, so they appeared to be shiny. The cap refill in her fingers was normal, but was slow in her toes. The next system I assessed was abdominal. During the review of systems, the patient reported that she once had a hernia, she has had abdominal surgery to remove a bowel obstruction, and she has recently experienced weight loss due to eating only regular meals, no snacks. However, she is still obese with a body mass index of 45.5. She did not report any fever, nausea, diarrhea, constipation, dysphagia, appetite changes, or working in a harmful environment. Next, I inspected her abdomen. The patient is obese, but her stomach appeared to be symmetrical with normal hair distribution, contour, and color. She has a scar from her abdominal surgery, but no abdominal lesions or surface motion. I listened to all 4 of her abdominal quadrants and heard about 20 bowel sounds per minute, which is normal. I did not hear any bruits over her abdominal arteries. She was in pain when I started to palpate lightly, so I did not palpate deeply. She did not feel any pain when I lightly scratched her abdomen to test for cutaneous hypersensitivity. I did not test for the rebound tenderness because she already has abdominal pain. Because she could not move her lower extremities very well, I was not able to do the iliopsoas or obturator tests. The first pertinent system that I chose was musculoskeletal. I thought that this would be an important assessment to perform on the patient if we had more time, because she is chair-bound or bed-bound at all times and uses her joints and muscles less than normal because of this. Another reason I felt that it would be useful is because during the peripheral vascular exam, I noticed edema and tenderness in her lower extremities. During the abdominal exam, she could not lift her leg enough to do the iliopsoas or obturator tests. She is experiencing weakness and limitations in range of motion. According to researchers at the School of Health Science at Swansea University, it is important to assess the musculoskeletal system of bedridden patients because long periods of immobility can lead to loss of muscle strength and endurance and bone weakening. Immobility can also lead to altered skin integrity and a weakened immune system. Because the patient's legs are no longer bearing the weight of her whole body, they are weakening the fastest. Doing the musculoskeletal exam on the patient regularly would help us to monitor problem areas and strengthen areas that are weak. The second pertinent system I chose was respiratory. This is a pertinent assessment for the patient because she occasionally experiences shortness of breath, which may be due to her obesity, the fact that she has asthma but has not had an attack or needed to use her inhaler in many years, and her lack of exercise. The patient does not smoke cigarettes or have any type of regular cough. According to the U.S. National Library of Medicine, it is important to do respiratory examinations, especially on obese patients with hypertension, because while bedridden, they get less exercise, eat more, and in turn, their cardiac output increases and their left ventricular end diastolic pressure is elevated. The patient's respiratory rate and lung sounds should be monitored for any changes so that they do not worsen. Sounds of wheezing in the lungs could indicate that her asthma condition is worsening. Thank you.